are back on the Morning Brew with Friends, and our new little friend Sugar just took off, the little dog. She'll be back, though, later. It's all right. And we're going to play with her. But in the meantime, we have, this is awesome, great show today. You are Dr. Esme Finlay, and you're with the UNM Cancer Center, the UNM Cancer Center. So what are you doing there? There's always awesome research and cool stuff going on at the Cancer Center.
Yeah, so I'm a medical oncologist, which is a chemotherapy cancer doctor. And I'm also a palliative care doctor, which is an area of medicine where we focus on pain and symptom management and helping people live well with chronic and serious disease.
And that's a field that I know is, when you used to hear chemotherapy back in the day, you would say, oh my God, they're on chemotherapy. And it was like the cure was almost worse than the disease. Mm-hmm. And now that's not the case anymore, is it?
Yeah, I mean, I think we're doing a lot better with medications and other things to support people through their cancer treatment. So we can get people through it without all the nausea and throwing up you used to hear about, and really help people stay engaged in their lives.
Right. And this is awesome. You are one of 44 people nationwide to be recognized as the Inspirational Leaders Under 40 by the American Academy of Hospice and Palliative Medicine. What is that award, and how did you get that?
Yeah.
One of just 44 in the world, I guess.
Yeah. The American Academy of Hospice and Palliative Medicine is our national organization for palliative care, and they selected up-and-coming leaders in the field who are doing interesting things, and I think my commitment has always been integrating palliative care and oncology to help cancer patients feel better while they are dealing with their cancer. And so I've been speaking nationally, locally. I do education at the University of New Mexico Medical School on those topics, and that was why I was chosen.
Cool. Does that give you any time to actually work with patients?
It does, yeah. I focus on head and neck and lung cancer patients in the clinic, and also see patients for palliative care in the hospital. Very cool.
There's all kinds of research going on at UNM all the time in cancer. There's always something really interesting.
Yeah.
Other than what you're doing, what other kinds of cool stuff are you seeing at UNM?
Well, I think we have some really cutting-edge stuff coming. We're developing our own panel of genetic tests that we hope to be able to run on people's tumors to tell whether or not they have mutations that we can target with drugs. So that's kind of the next wave of cancer care.
Rather than surgery or something else?
Well, you might still get surgery, but when you're at the point where you need chemotherapy, it's this field called personalized cancer medicine.
Oh yeah, we've had some folks on the show talk a little bit about that, genetic testing, and it sounds like it's very fascinating because you can actually figure out, person X's DNA in their cancer, and then you can actually say that's the protein, that's the bad cell.
Yeah, and so if they have a mutation that we didn't know was there, but there's a drug that targets that, we might do a better job at killing their cancer.
That's pretty cool.
Yeah.
For years now, we've been hearing about people doing just amazing work in cancer. Do you think we can actually solve the mystery behind it? I mean, are we close, or is it still this insurmountable mountain?
I think we have a lot of work to do. I think there are positive things happening every day, and I think the research is just taking off, particularly in this area of personalized medicine, and with some really neat new drugs that are training our body's own immune system to fight the cancer. So I think there's some great things coming. We don't have the magic cure yet, but we're doing well.
You think there might be something like that, in our lifetimes, 20, 30, 70 years from now? Is there a chance we might even see cancer get solved? Or is it really that much of a mystery still?
I think there's still a lot to learn.
Really?
But I'm optimistic that we're making great strides.
Yeah. Where are the interesting, other than genetic and personalized medicine stuff, what are the other interesting things you're seeing in kind of the cancer business, as it were?
Something that's really interesting to me is that there are now several studies that have been done that show when you do good palliative care, which is pain and symptom management and emotional support for patients.
Because that basically lets the whole person heal in the long run, right?
Yeah, and it helps them make the right decisions for them.
Because you're not worried about the pain, you're not worried about the chemo, you actually get to think ahead.
Yeah, and you might actually do better with your chemotherapy if all your symptoms are under control. And so there are a few studies that show that people have actually lived longer when they have palliative care. And so that's really neat because it's not a drug, it's not a surgery, it's not radiation. It's just support for pain and symptom management, and people do better and even live longer with it.
That's very cool. And is this, you know, when you think about pain management, is this the kind of thing where you pump somebody full of morphine, or is this something a little more like managed drugs, managed pain, how to basically deal with the pain, teaching them how to work through it? How do you
Optimally,
do that?
it's both things.
Okay.
It's using the right medicines at the right time and teaching people how to use medicines, but also treating anxiety or depression that might make pain worse, helping people with physical therapy or things like that that can help them feel better. So using as many things as possible to help them heal.
And so if I hypothetically had cancer and had to go in to see a doctor, is it the kind of thing now that they just say, hey, and by the way, here's a palliative care specialist, or should I have to say, can I see a palliative care person as well?
Depends on your doctor. I think we are a very young field. We've been an official field in medicine for less than 10 years, and so not everybody knows about us. At the University of New Mexico, we now have an outpatient palliative care clinic, and you can ask to be seen there. And if you're in the hospital and you're affected by cancer, you can also ask to be seen by a palliative care specialist. So I think it's a combination. Some doctors make the referral, sometimes you have to ask.
Cool. And then just briefly, how did you get into this? How did you decide this was the medical field you wanted?
Yeah. I think I was affected by some family members early in my life who had cancer, a grandfather and a grandmother.
And you saw them not getting the other kinds of care they needed.
I did. I saw my grandfather was in quite a bit of pain, and it was in the 80s, and we didn't do as well with that. And so it really affected me, and I wanted to make sure other people didn't go through that. Sounds
like a plan. We can find out a whole lot more about what you're doing and everything else at the Mexico Cancer Center at the UNM Cancer Center. Cancer.unm.edu, which is kind of an ominous URL. but there's awesome stuff that you can find out if you or someone you know needs it. And thanks for coming on. Appreciate it. Love hearing about all the advances in cancer research and everything, especially helping make people's lives better when they're suffering. We're back in a couple of seconds. We got a full show this morning on The Morning Brew with Friends.